All right, today I'll be showing you how to perform cholesterol testing, which is a full lipid panel that we provide for our customers. And so these are the supplies that you'll need. We have first the Chlestech machine that provides instant results in 5 to 7 minutes. We have latex gloves, gauze, a lancet. This is your capillary tube and capillary plunger, the Band-Aid, alcohol pad, the cassette, which has a little well that you'll put the blood into, and it has a cassette strip on the right side that you'll plug into the machine. And this is the optics check machine, and then our bibs. And then we also have a biohazard waste basket that will put all the contents that have any blood on there into it. Every time you will be doing cholesterol testing, you will need to make sure to run an optics check to make sure that the machine is compatible with the cassettes that we will be running and providing accurate measurements. So you will take this gray optics check box, and inside it is a cassette that looks very similar to the cassettes you'll be using to test. And on it is some numbers that will be important for you to know when the range comes out. So you'll hit the run button, and you will place it in the machine just like you will do with the cassettes with the blood. And the drawer will pop out, and you'll place it in there, hit run again. It takes about 10 seconds for us to get a reading, and it will pop out when it's completed. And there'll be 4 numbers that will pop up that we will want to make sure fall within range. If they don't, we have a problem with the machine that needs to be calibrated. And you can see on here there's 4 numbers, and the range is 80 through 105, and we have 90, 86, 88, and 92. So this machine is great. These are the lancets that poke a little bit deeper, so we're able to make sure that we're getting enough blood, especially for people that have calloused hands. It works really well on men especially. So what you do is you turn the top, just twist it, and it will pop out, and you keep twisting and pull out the top part so that the blade is not exposed in there. And then you will push this to the skin, and there is a little push button that you will push down, and it will eject the blade into the finger. So first, what you will be doing is putting on the gloves, making sure that everything stays sanitary. We are touching people's blood that can be transferring of disease and things like that, so we want to make sure that we're very careful with that. Key things to make sure that you perform an adequate test for the individual that you're testing, making sure that they've been well hydrated the day of, drinking at least 20 to 30 ounces the morning of the test, and fasting 10 to 12 hours before testing, especially if you're doing a glucose test. Making sure the individual hasn't been exercising the morning of to make sure that we're not having people pass out with having low blood sugar. And then also making sure that their hands are warm during the test, so it helps really get the blood to come out of the body a little bit easier. So the best way to make sure that you're testing is to poke their middle finger right here, and grabbing 2 fingers, you're gonna apply a lot of pressure, getting that blood flow to come and get those capillaries moving so that the blood comes to the end of the finger. And doing what hand feels most comfortable to you. Most people use their right hand more often, and so they're having a lot more blood flow going through that, and so it makes it a lot easier. And so the steps are very important for an accurate test. So first, you will take your alcohol swab, and you will clean the area very well and allow that to air dry. Waving it, you don't want to poke them and have the alcohol be pierced with that. After you fan it, you'll be wiping the area with the gauze just to dry it off a little bit more. Then we'll take our capillary tube and our capillary plunger, put it in the red side. It will go as far down as it's able. And then we'll take our lancet. This one you just twist the top and pull out. And it's very important that we collect the blood very quickly and put it into the capillary tube and then directly into the cassette. It takes about 5 to 7 minutes to process, and we need to get the blood from the capillary tube into the cassette within 30 seconds. and then it can sit in the cassette for 5 minutes, but the quicker that you can make it go in, the better for accurate results. We don't want to poke people more than we have to get a result. And so after I'm going to poke on the side of the finger. It tends to hurt less and it has more capillary beds on there. You're going to poke and you're going to wipe the first drop of blood like that. And then we're going to squeeze with the 2 fingers, and putting the capillary tube parallel with the finger, we're going to allow the blood to automatically soak in. And this has great soaking powers. It will automatically be attracted to the tube. You don't actually want to touch the tube to the skin. It can cause room for more error. Once this tube is automatically filled up to the black line, which is required for it to get an accurate result, you will take the capillary tube and place in the well of the cassette and push all the way in so that we have the blood filled up. Then we will hit run on the machine and the tray will pop out. I like to actually have the tray out before I even poke them so that we can put it right in. You put it in and hit run again, and you will wait for the 5 to 7 minutes. You will then hand gauze to the client that you will be testing and be able to not have blood run on the table. Then once you're ready, you can put the Band-Aid on them for them. Grab all of your supplies that have blood on them and hold it in your hand, and then you can take off the supplies with your gloves wrapped in it, throw it in the biohazard trash can, and wait for the results to show up. There will be stars that will show up on the machine for each minute that it's completed up until that 7th star. And then your results will be ready. Once the test has been completed, then the machine will automatically pop it out and your results shall display at the top. And you will make sure just to arrow through the data to collect all of the numbers that are produced by the test. Make sure to dispose of the cassette in the biohazard waste bin after you've finished this test.